everyone. Thank you for joining us for the Center for Justice and Law Spotlight Conversation series, where we talk about health, justice, and the law with guests. I'm Tsion Tulu. I am the fellow and program coordinator at the Center for Justice and Law. And this is one of many spotlight conversations we've had around the topic of immigrant and refugee health. Our conversation today is with Raniya Yimam. Thank you for joining us. I wanted to have you as a guest because you and I always end up having conversations about the immigrant and refugee experience, with both of us coming from those backgrounds, and you have helped shape my perspective on these like topics a lot over the last year or two that I've known you. So it's an honor knowing you, and it's an honor to have you here. And I'll just let you introduce yourself.
Yeah, thank you so much for having me here. I actually feels great to be as a guest on CGL. So yeah, my name is Raniya Yimam. I just graduated on this May, and I studied public health and global studies. Um, yeah, that's a little about me.
Yeah.
Yeah.
So just to start off the
Mhm.
questions or the interview, how do you personally identify with our theme this year of immigrant and refugee health? So it
Yeah,
can be anything.
yeah, thank you. Um, I was actually taking this year off after graduation. I just wanted to take a year gap and apply for grad schools and gain experience. And I've had the chance to be a Minnesota Land Fellow. If people don't know it, Minnesota Land Fellow it's a fellowship program. So LEND stands for a leadership, education, and neurodevelopment and related disability trainings. And they do have programs for healthcare professionals, family members, policymakers, just related to this neurodevelopmental disability. So it was funded from the maternal and child health. Also, the bill autism cares supported. So there are so many different projects you get to choose and work on. Any particular whatever you're interested in. They have so many clinical side, like autism intervention, early intervention, and vaccine confidence project. So I am currently working on a vaccine confidence project, explicitly like targeting the East African disabled immigrant community. So there are like a lot of some like rumors about vaccinations. So I organize workshops and training to encourage and enlighten people about the importance of vaccination. And the workshop and training are conducted in Amharic and English for better understanding. So yeah, I'm currently, we're preparing informative brochures in Arabic, Swahili from even different people. I'm talking to them, so they're helping me in Oromo and Tigrinya and Somali and Amharic. Just the importance of COVID-19 vaccination. And yeah, we meet different fellows outside of Minnesota every month, and we learn different techniques from different states. And there's also training that goes beside it. So yeah, that's what I'm working on.
That's really great. That sounds amazing.
Yeah.
Tell me a bit more about how it's been to work like frontline in the with like immigrants and refugees of a similar background to you, and like what challenges you see or you perceive with working with them. And I know obviously you've talked about like a language barrier being one, since you've lead these workshops in all of these different languages.
Mhm.
And yeah, like how has that been reflected so far?
Yeah. So when I work with different immigrant community, I've not only about the vaccination, but also about autism or any related to neurodevelopment disability. There's this cultural or religious um, that people would believe, which is okay. But there's also like parents are struggling to get resources, and then people are in denial of getting this intervention early before it got worse. So I got that kind of challenge, just explaining things. They can get resources. And then there are a lot of hidden stories that I've heard from our community, actually. Some dads are like, some fathers are ashamed of their kids due to, like, frustration, and they result abusing their wives. And that was really very challenging for me, and I feel like that comes from cultural perspective, like shame and taboo, um, about those things. So it was really interesting for me. There are people who still don't get those resources, even though there are so many resources out there. And that really goes to the language barrier. There's so many, even though there are so many things out there, there's language barriers. And also, we still need resources for the immigrant community, especially about these topics. I did not know I would get into this. My options were open as long as it's public health, but this really got me, and I was like, wow, there's still need work to do.
Yeah, no, it sounds like it. From what little experience I know in that field, and especially within like our own community, I'll specify it to like East African communities, at least, like I know already the topic of disability and the topic of vaccines and all of that already is a very polarized thing within our community. And it's like you said, very taboo, not really talked about, and it's very much like linked with shame and very hush hush. And so I can understand, like, working in that environment and working within that realm can definitely be difficult at times. And seeing those sides of our community members, where shame manifests into anger or frustration, and it can be at the health systems or the other systems that they're working through, but most likely it ends up within the family. So that's definitely something that's really hard to witness and know. But I'm really glad that you're within this field and you're helping people. That's amazing.
And like, some people just can like relate the disability and vaccination. That was also something that I saw. I heard this person that I was helping. So my first son is, he has this disability, so I don't want my next son to have this disability, so I won't, I won't just take him for vaccination or whatever. And there's so many like that kind of false narratives in our immigrant community, and it's really challenging.
Yeah, especially with COVID getting worse and worse, and we're going through another surge right now. And knowing that already the vaccine hesitancy is really big, and it's like vaccinations are really low within our community, and a lot of times people from immigrant and refugee backgrounds come from like low economic, socioeconomic statuses. And so that even and they're usually on the front lines, and so more at risk at getting COVID. So that just makes them more vulnerable to COVID, more likely to end up with extreme, symptoms and near-death experiences, and then having to go through the health system on their own too. So no, I can excuse me, understand that that's a really big topic to be handling.
It is. And another thing that I saw was like, caretakers. If like, I saw this, well, she's a person that I help too. She is a caretaker for her daughter, and she's a single mom, full time taking care of her. And her daughter is in high school full time. And it's really like, they're living, they're low social economic, and the caretaker don't get paid that much. So I've seen a lot of family that are struggling, that their caretaker is not getting paid well, and they're not living on their standard. They're always, and whenever there's like a social, like, when there's like a social security hub. um if you don't get this, if you don't make this amount of money, you can't get social security money. And there's like so many complicated situations. And I was helping this. She's also my neighbor, and she was also out from my community. So I was looking at her case, and it was very complicated for me to understand. There's a language barrier, um, and then also like it's like there need to be ensure everyone clearly understands the social security policies, and there's no guideline in different language. We need to also like provide legal advisors, who can help as my neighbor. And just to even to fill out a form, it's very challenging. And yeah, just navigating this brutal system is really hard. And I've seen a lot of people, advocating for the equal access for social security benefits.
Mm-hmm.
Yeah.
No, that's definitely, I haven't heard too much about that, but that's really interesting to learn more about that. Yeah, it's really hard. I think a lot of people don't often think of think of immigrant and refugee communities, the legal statuses that come with it, and then the benefits and bad sides that come with having one or not having one, and the dangers of it. I know in previous spotlights we talked about being in DACA and undocumented and all of the different things. But even when you have the citizenship or a legal status, navigating the systems that are already there, like you said, social security and everything else, is another big barrier that a lot of people have to go through and don't have really access to resources. So yeah, no, I definitely can see that. And sorry, shifting gears just a little bit. I know that, and I know our upcoming fall conference is on the topic of skin lightening and colorism within immigrant and refugee communities. And I know that although skin lightening and colorism is a very big topic covering many different populations, I know that it's also common in East African communities. And I wanted to ask, like, as a Black woman and as somebody from an immigrant background, how do you perceive colorism and skin lightening and that topic within your community?
Yeah, that's a very good question. I feel like colorism is it's influenced by racism. And I feel like colorism came from history when Black women were looked at ugly and people could use dehumanizing language to, to humiliate or rebuke them in society. And having dark skin tone color wasn't embraced before. And as a result, a lot of women were ruined emotionally and psychologically. Growing up in Ethiopia as a young girl, I remember people could define beauty based on skin complexion. For example, people could say things like, I don't know if you heard this, but people could say like, she looks like an Arab, she's beautiful, something like that. I've also encountered people with publicly bragging about, oh, I prefer light-skinned girls or something like that. So yeah, and the implication of colorism is my community has led some people going for bleaching creams to change their skin, and also like to resemble what people perceive as the best skin tone is, like and I remember, I don't know, growing up, I remember there was this cream that makes you really white. It's not a bleaching cream or a makeup, or it's like a lotion. People just apply it and then it's so white. I remember it was so white. And it was back in the days, probably when I was 6-7 years old. But I still remember how cheap it was, and you can find it every shop. It was like accessible for anybody to use it. And I feel like that pressure comes from Western culture, and we all have beautiful skin in our own our defined way. But unfortunately for us, beautiful, like, people define beauty before we even had a chance to define for ourselves. Does that make sense?
Yeah.
Like the arrival of Western culture and Africa has, like, I feel like it has a significant influence on Africans' colorism perception, and also like just the philosophy of black color, like completely, change every sadness or heartbreaking moment is closely to a black color. And when I don't know, in Ethiopia, when someone dies, everyone wears black. And I've also wondered why black is always the sign of sadness. Why not white or blue? Who's behind and naming those colors? And yeah, and I feel like being beautiful or having the best skin or having whatever the skin color is defined for us, and that really influenced. Yeah,
Yeah.
yeah.
No, I definitely agree with that. And I loved that you brought up the term of being like, oh, she looks Arab, so she's so beautiful, and making that a synonym or like synonymously using that. And like the same with me when I grew up in Ethiopia, like at least until I was 6. I know that a lot of our media that we have access is to like Arab media, like we have Bollywood and we have these Turkish and Arab shows and Al Jazeera News and all of those things. And so growing up, that's what you see. And obviously you have like, Ethiopian media and dramas like that. But growing up, if that's what you see, and if that's, something that, and also the Western world coming in and defining beauty standards, your beauty standards are very warped. And I think a lot of times in East African and like North African countries, it's very synonymous to like you said, like the Middle East and having paler skin, like straighter narrow noses and straight hair. And like there are so many different Ethiopians come in so many different shades, and yet the most seen on TV, the most viewed and valued are people who have lighter skin complexions and sometimes have to bleach their skins. And and even though we have like in the like Omo Valley, we have a completely different tribe with like darker complexions and wider nose bridges and all of these different people. And yet like I all I'm saying is like I completely understand and definitely identify with that. The colorism is so embedded in our culture that we can't even see past it. It's in our language,
exactly as if it's normal.
Arab. Or like when you're complimenting a newborn, like if you're visiting somebody and you're complimenting them, you say, oh, Kaina, so it's like she's red, she's like light skinned, which is a term to say, it's a term of endearment. But when you step back and you look at that, you're like, oh, okay, that's kind of meaning.
I know someone that literally prayed that he could have a light-skinned baby girl. Literally, he was very thing. And it's really, it's as you have said, like it's just because of the media we had back there in Bollywood and Arab shows, like Turkey shows, and it's very interesting.
No, it's definitely something that you become more aware of the older you get to. And like moving out here, it doesn't change because colorism is now embedded in different things, but I'm glad that you brought that point up. And
I remember, sorry, were you gonna
go ahead? No, go ahead.
Yeah, I remember last year at this time I was getting a facial done, and then the lady was like commenting, oh, you have a beautiful skin, it's not bleached. And I was like, oh, what do you mean? And she's like, oh, you're probably from East Africa, right? Yeah, I told her I'm from Ethiopia. She's like, oh, a lot of my clients are bleached, so I was like, wow, that's that bad. And she knows Like it was really hard to hear that. And I was like, oh, who are your clients? And she's like, oh, I have so many Ethiopian clients. I have so many East African, Somali, and so many clients. But a lot of my clients are bleached, and it's really bad for their face. And I was like, wow. And I remember, like I think it was that month I was walking to East African Mall, and I saw a bleaching cream store, and like literally they say that they ask you like, oh, do you want it for a week, or are you gonna be a new like a new are you gonna get married, or how long do you want to get white, just there are some questions like that. And I was very very surprised, actually very surprised. So um it's really sad to see that. I didn't know there was a store for it, but there's actually a store for it, and people know it's dangerous, but they still do it.
Yeah, no, I didn't know that it was common practice. Obviously, like we said, there's like colorism and
Yeah.
all of these different things, but I didn't know how common skin bleaching and skin lightening
Exactly.
was, like to that
Yeah.
extent.
People used to hide it when I like a long time ago. People used to hide it, but now it's like I think it's common. It's yeah.
Yeah.
People just tell you, oh, if you're gonna get married soon, just go get just go get your bleaching cream or whatever. It's I think it's becoming common.
Yeah. And we don't really know about like the health impacts until
Mhm.
later on. Not even just like how your skin is damaged, but like the mercury poisoning that can happen and all of the different impacts of it that it has on your health is so like
Yeah,
it's very very harmful. Yeah.
it is. It is. Yeah.
Yeah, so we've discussed a bunch of different topics, a bunch of different things, but um, are there any like organizations or resources that you'd like to share with the audience or that we can boost for you? It doesn't necessarily have to do with skin lightening or colorism, but anything that you've talked about. I know you talked about your fellowship as one,
Mhm.
or like any
Yeah. I think
sources.
yeah. Minnesota Land Fellowship. It's part of U of M. If someone, if anybody's interested, they can also contact me. But it's very um amazing amazing program. We get to choose different kind of or different kind of topics, and work like literally work. You just don't get trainings, but then you also work out there. You do community engagement if you want to do research, or if you want to do a clinical side, if you want to talk with doctors. And also it's not only for students or for someone who's graduated or whatever. It can be parents, it can be professors, health professionals. Anyone is anyone is welcome to apply. It's called Minnesota Led Fellowship. Yeah, I would want to share that. um, and it has literally a lot of topics about disability, spatial disability, and it's not only in Minnesota, it's also like from different states. Like there, like I mentioned earlier, we meet every month with New York fellow, with the New York fellow, with DC fellow, like different kind of states, and there's so many things that we can learn. And also they do have a global projects. I know one of my colleagues is going to, I believe, to Nigeria. Oh, I think it's in Nigeria. So they do have global disability work too. So it's amazing. Yeah, it's amazing fellowship. I would just want to put that out there.
Yeah, that sounds amazing. Thank you so much. I think then if you could leave this conversation with one anecdote or message about this topic, and this can be like immigrant refugee health or colorism, skin lightening, what would it be, or what do you want people to know about immigrant and refugee health?
Yeah, I think one message I would say about immigrant refugee health is that there are so many things that are not done right. Therefore, like as a young people, if we don't desire and strive to be in a position that can, influence system change in our community, change will remain the same, and our future generations will be the same. So I call upon everyone to be responsible and dedicated to changing the refugee health hardships, and we must also ensure equity in health access for all, regardless of their color or whatever. And and as a community, we learn to share available resources with others. And I just, finally, I just wanted to say, if you don't find resources or specific trainings you want to share to your community, because of language barriers or other stuff, just create it, do it yourself. Yeah.
Yeah, thank you so much, Rani, for all of your words of wisdom for this conversation. And to the audience, thank you for joining us today. Be sure to follow us on Instagram and Facebook, and tune into our previous spotlights, which are all archived, or our future spotlights that will be happening. And tune into our upcoming event this Friday, December 3rd, from 10 a.m. to 2 p.m. on skin lightening and colorism. You can find the registration information in our social media on Facebook and Instagram. And thank you for tuning in. Thanks so much, Rani.
Yeah, thank you so much for having me. It was so nice talking to you. Yeah.
You too.